Horsing Around, brought to you by Roy Fry Western Lifestyles, dressing Northeast Kansas their Western best for over 57 years.
Hello and welcome to Horsing Around. It's Dr. Chris Blevins here at Kansas State Veterinary Health Center. I'm the equine field service clinician here at the vet school, and today we had an interesting topic about hooves of the horse. And maybe you've heard kind of the wise tale of the horse has 5 hearts. That's the one in their chest and all 4 feet. And so that can be very true in most aspects of the horse, and they have to have all 4 of their feet working properly for them to be able to do just the routine stuff, whether grazing, walking, ambulating, and in addition to the other stuff that we put these horses through competitions and riding. And so making sure that they are not sore or lame is very important. The details of the foot are fairly extrinsic in what is involved with the foot. You look at their bone, and what is incorporated within the bone is very important. One of the things to remember about the foot is it has like Velcro that attaches the bone with the bone inside the foot to the hoof capsule, and that's called the lamina. And so that looks just like just kind of the pressing together of Velcro. And if they start to get inflammation in any of that aspect of the foot, there can be some pretty significant lameness or soreness that the horse would show. One of the things that I think any horse owner should be able to do and pick up is pretty significant lameness where they're not wanting to put weight on it or shifting their weight around, but then also to be able to feel for the heat and warmth around a foot, so feeling around there for any heat around the hoof capsule and above, right above on the hairline there, and taking digital pulses. And so most of the time the ankle area or the fetlock, we can check digital pulses on the horse, and if they become bounding, so you can really feel the pulse inside that foot or that horse's leg down at the ankle or that fetlock, then a veterinarian probably should get involved for sure in trying to figure out what exactly is going on, because it is an aspect of showing inflammation and or pain of the foot and needs to be addressed. There's multiple different things that a veterinarian can help with, including nerve blocks, blocking the foot out in different areas to figure out where the lameness is coming from, whether the heel or the toe or even further up on the leg. Most lamenesses, whenever you look at a horse, some people think it comes from the shoulder and the hip, but by a percentage, most of the lamenesses come from the fetlock or ankle area and below. So the foot is a fairly common area to have problems with pain and inflammation. When you look inside a hoof capsule, and we have a cross section of that, that it is fairly extrinsic in what is involved with it, and it shows just the bone and a lot of the blood supply and joints and even small bones that are involved within it. And when you start trying to look at some of those things, they can really be kind of frustrating and very complicated in trying to diagnose a certain problem. When we come back from break, we'll go to even more depth into what might be going on inside the hoof capsule and where some pains may be arising from. Please stay tuned, and we'll be back with Horsing Around.
Horsing Around, brought to you by Roy Fry Western Lifestyles, dressing Northeast Kansas their Western best for over 57 years.
Hello and welcome back to Horsing Around. I'm Dr. Chris Blevins here at Kansas State Veterinary Health Center, and I'm the equine field service clinician here at the vet school. Just like before we went to break, we were talking about the hoof of a horse and the importance of the hoof and where maybe some problems could arise. And now that we're going to get into more depth about the hoof capsule and what's inside the hoof, is a lot of extrinsic details of the bone and a lot of soft tissues involved around there. You know, when we talked about before break 2 about laminitis or founder and what that could be involved as far as those velcros that are attaching this bone, which is the coffin bone, to the hoof capsule. If they have laminitis, they can get inflammation along this bone here, and the bone comes apart from the hoof capsule. And when that happens, then that weight of their whole column of bone could push that bone right out the bottom of the hoof itself. So we definitely don't want to get to that point. And again, veterinarian can help try to decipher some of those lamenesses, but what's going on. But this at least gives you an idea of the different things inside this hoof capsule that we are dealing with in this bone. And when you have laminitis or inflammation, you can actually get the aspect where, again, this bone comes out the bottom of the hoof. And so this was a specimen here that had laminitis or founder, and you can see also from this that this bone is rotating off the hoof capsule. So the velcros came loose and it's rotating and causes inflammation and rotation. How does a veterinarian be able to diagnose that? That's all kinds of different things that they can do based on nerve blocks diagnostic procedures, but also radiographs. And so those things, sometimes taking a picture, x-rays of the hoof are very important in trying to decipher different things. The other place where some horses have problems is the navicular bone. And so when we talk about the navicular bone, that's the heel area or heel pane of the horse's hoof. So it's usually the back area of the foot. And it can incorporate this little bone right here, which is the navicular bone. A lot of times, again, the veterinarian can do a lot of diagnostic tools to try to figure out if that's where the source of the pain could be coming from. And in addition, is it the bone or even other soft tissues around there based on different diagnostic modalities that they could use to decipher where and why they're painful on there. A lot of times, you know, based on the treatments, we need to figure out initially what the cause is, so then we can sustain the horse for a longer life. And a lot of times once you get them comfortable, they're going to be fine. But until they have that comfort level based on diagnosing the correct treatment, then we could still be in a lot of problems. So making sure that a veterinarian gets involved with the lameness when you first start to notice it can put it off so maybe it's not going to be as bad later on when you start doing treatments. So again, this bone, navicular bone, coffin bone, joints, attachments, and you can see just a nice cushion of the heel here too. All those things are very important for the horse's hoof, and again, have your veterinarian involved if anything ever happens. Dr. Chris Blevins with Horsing Around here at Kansas State Veterinary Health Center, and we'll see you around.